Hi, Lysa.
Hi.
How long have you lived in Vegas?
About 25 years.
So you're like 29?
Yes.
Yeah. So you are a cancer survivor.
Yes.
Why don't you just give us a quick snapshot of what you've been struggling with?
Well, initially, when I was first diagnosed almost 6 years ago, I was a late bloomer and had just graduated college. So I was diagnosed a month later. So I was unemployed and uninsured. So that was a challenge in the beginning. Because I was admitted to UMC right away to deal with the tumor location and what was going on, a social worker approached me and did initially enroll me for Medicaid to help get my treatment paid for. And then a lot of changes were made when the Affordable Care Act went through. The program that I was on was eliminated. I had 2 months before I was able to start Medicare, which was 2 years after being on disability, where I had no insurance because I didn't want to purchase insurance for 2 months, couldn't afford to purchase insurance for 2 months, so I just crossed my fingers and kind of hoped for the best. I have been on Medicare since, though, for over 3 years, which has treated me pretty well for the most part. I'm lucky I haven't had to have treatment changes either in that time.
Well, I wanted to start with you and your story because what we're talking about in this cancer in the community question, particularly here in Las Vegas and more broadly throughout Nevada, is the infrastructure that surrounds people who are struggling with this. And I want to jump to Oscar for a minute, but before I do ask you, in the time that you've been struggling with this, have you noticed any changes here around things that are available, accessible, the technologies that are brought, the literacy of those treating you? Have you noticed anything from your side of this as really being a client in the system?
Like I said, I've been lucky. I've been on the same drug for 4 years, so I haven't had to. I literally go in every 3 months and have my blood work, have my scans, say hey to my doctor, everything looks good.
Right.
So I haven't had to navigate a whole lot of situations currently, but I do know, especially being a lung cancer survivor, there are no lung specialists in Nevada, which I love my oncologist and got very lucky to be placed with him. But because things are changing so fast, especially in the lung cancer world with treatments, that it's hard to expect him to keep up to date on that when he's dealing with, it's not his specialty.
Right.
So I bring him a lot of information, he brings me information, but I think having access to a large cancer center, even like UCLA or in Boston, Mass General, not having that access does make it challenging for some patients, especially someone like me that has a very, very rare driver mutation.
Right. Thank you. Oscar, you've been at this for a long time, and Parvesh, we're going to get to both of you, but Oscar, you've been at this for a long time. You sort of left the state, but you're from this state. Your parents basically run this town. I think most folks out here know that. You clearly didn't want to go into politics and wanted to, become a doctor or something like that. But, when you're out there and kind of looking at the broad infrastructure that surrounds this and your own concerns, what do you see as the next big challenges? What are you trying to fix, particularly with the Lysas of the world in mind?
So Las Vegas, the analogy I like to use is Las Vegas is in its adolescence. It's growing up fast. We've been for a number of decades in the top, for a number of years, we're actually the fastest growing city in the country. And healthcare, and particularly oncology care, really hasn't been able to keep up with that. The way I view our current status is we are, as providers, we're a lot of diamonds in the rough. We can provide excellent care. In fact, I would argue we provide world-class care here in Las Vegas. It's just that you need to know where to look. And I think what we really need to do is gather all these diamonds together and develop the infrastructure so that we can take it to the next level, i.e. we can become adults and contribute meaningfully, not just locally, but globally. And so there are a number of sort of facets on and I could talk about this for an hour, but basically we need our community to step up here. And this is no joke.
Well, what does that mean in real terms? Because we've got the community here. Most folks out here have some hand in this game somewhere. What do you want them to do?
Well, so it's basically a call to arms. We need to have people that have the dollars get involved here. I would like to shout out to one example list that I've already been aware of is the Sapphire Foundation for Prostate Cancer Research. They help our patients day in and day out, and they also fund research locally in the Valley. So we need more examples of this. We are a wealthy community. We're in the top quartile for per capita income. And so we really need to develop this infrastructure with the appropriate oversight. And I think that's probably where Dr. Kumar is going to come in here. But we are, now we have one new medical school and another one on the way. We need to basically all get together as a community and hash this out. We need to have more dollars, more federal dollars coming in to fund research. We have no federal dollars. We have no, for American Cancer Society, we have no current active funding in the state of Nevada. There was one grant that's just running out right now. So those are examples of how we can step up here.
Mm-hmm. Parvesh, you've moved here, as I understand it, from Kansas and others, and you're sort of the miracle man, the rainmaker for places, as I understand it. You were in Kansas before, and built these National Cancer Institute designated centers, and that's the hope for UNLV, the new medical center here. How does that burden feel to you? Is it doable?
Oh, absolutely. I mean, I'll share with you my example at the University of Kansas, and part of that, I was chair of radiation oncology at USC Keck School of Medicine in Los Angeles.
Have you ever failed anywhere?
Look, yes, I have.
That was a joke, guys.
And I think, yeah, Steve, you learn from your failures. You go out and celebrate your successes. Failures are probably the best thing that can happen to an individual, because that's how you get better. But it's not really, quite frankly, about success and failure. It's really, quite frankly, finding a cure for cancer. I mean, I went into academic medicine with the goal of putting myself out of a job. So in the overall scheme of things, I have yet to find a cure for cancer, so I consider my mission to have failed thus far.
Right.
So having said that, but I'll start with my experience at USC when I was chair of the Department of Radiation Oncology there. In LA alone, there are 4 NCI-designated cancer centers. In the state of California, there are 7. What are NCI-designated cancer centers? There are only about 67 of them. The purpose of NCI-designated cancer centers is to reduce the local regional cancer burden in your community, meaning either through prevention, diagnosis, treatment. We have to find a way to reduce cancer incidence and find a cure for cancer. Now, quite frankly, we've come a long way. The overall cure rates for cancer is about 65%. When I was at St. Jude Children's Hospital, that's where I started my career, the cure rates for leukemia were 10%. Now they're 85 to 90%. So this is definitely doable. Now, there are other issues like sequelae from radiation therapy, chemotherapy, surgery that we have to deal with. But getting back to your question, I was recruited from USC to University of Kansas to help them get an NCI-designated cancer center that they've been trying for 30 years. The entire Midwest didn't have an NCI-designated cancer center outside of Nebraska. And after a $350 million effort, and this was a med school that had been in existence for 100 years, my alma mater, had faculty, had great medical oncologists, radiation oncologists, but we didn't have the research infrastructure. On top of that, we invested $350 million to get an NCI-designated cancer center, and the purpose of which is to bring basic science researchers together with clinicians to tackle cancer diseases like non-small cell lung cancer. So we would bring an expert who's doing research in basic science in non-small cell lung cancer, team them up with a clinician who's actually treating patients and, stage 4 disease, which is what you had, and you're fortunate to have a biomarker that we can target. Well, that didn't happen on its own by magic. There were basic scientists who discovered that there were receptors on non-small cell lung cancers that could be targeted, and if you turn off those receptors, guess what? The tumor stops growing and it dies. But that probably took about $1 billion effort. So what is it going to take in Las Vegas, as Oscar alluded to? I didn't realize he was from such a wealthy family. Maybe Oscar's parents can contribute to this. I don't want to put you on the spot.
I didn't say they're wealthy. I just said they ran things.
They're influential. I assume in Vegas, if you're influential, you're wealthy. So I'm at UNLV School of Medicine, and my estimation for having an NCI-designated cancer center is probably about $1 billion. Now, that's not going to happen from the state, a state that doesn't have a state income tax. UC has a great system because 30, 40 years ago, they invested in that system, and now, they've become self-supporting. So I think it's going to take a huge community effort, as Oscar alluded to build that infrastructure. But, I've spoken too much. I can talk about infrastructure forever because we have a $20 million grant from National Institutes of Health to build infrastructure at 13 Mountain West universities in 7 states. And I've been part of this. I'm the head of this program, and I can tell you it's not just Las Vegas. It's not just Nevada. It's the entire Mountain West region. We have no infrastructure. And it's going to take billions in investment for us to make that happen. And it's not happening through the federal government, folks, because we're in debt, and you know what's happening in the Senate now with Obamacare. It's going to happen through community efforts and with all of us working together.
Oscar, I just want to, before I come back to Lysa, ask you, when you were planning to go into this field and you were looking at where you were going to get educated, where you were going to spend time, you clearly went away and you came back. And what I'm interested in is when there's an infrastructure and there's a medical center at UNLV, what are the things that begin sticking here earlier? And would you, not in your case, but people of your slightly younger than your age class, your research interests, on what it takes to kind of get what you would say in complexity theory, that the more you have of something and it begins building upon itself, you get businesses that are in the cancer area, you get students that want to come in here and do research, and you may find UNLV in Las Vegas, making a strategic leap from being, as Larry said a moment ago, kind of way behind the pack, being able to jump and leapfrog up to a higher level. Is that something that people in your research class are thinking about?
Absolutely. So it's really about critical mass. Sort of 2 aspects of that. It turns out that Nevada is in the top 10 states in terms of, even with our current infrastructure, in terms of people who are born and raised here, or I shouldn't say born and raised, but people who train here tend to stay here. And that's even with the current infrastructure. I think we're number 6 in the country. That being said, who's going to come from where I trained, New York City, Weill Cornell, to come to Las Vegas? My old advisor, and I hope he doesn't watch this, but he told me that Las Vegas, or coming to Nevada, would be a wasteland. I've applied for research grants, and I've personally been told that I will not be funded if I stay in here in Nevada. Even though I have good ideas, I will not be funded. I will not incriminate anybody on that one. But these are just some examples and snippets. And for me, it just makes me more driven to try to address this problem. So what we really need is critical mass. We need basically multidisciplinary groups, as Dr. Kumar has alluded to, that are multi-dimensional multidisciplinary groups. So these are basically research units from the bench research all the way through to the clinical trials. You need basically people who treat specific conditions, such as gender urinary malignancy. So you need that academic structure that I was fortunate enough to view during my training. And so we need to replicate that here. And the question is how to do that. It's a daunting task. I think it's really about the dollars, honestly. I think with the right funding, you can attract people here. It's an unfortunate truth, but that's what it's going to come down to.
Lysa, are you heartened by anything you're hearing these guys say? Or is this so distant from your world that it's irrelevant?
No, it's not irrelevant at all. We do need, I have friends that live all over the country. I'm connected with a large community of lung cancer survivors. And anyone, even just talking about, like, I had my scans yesterday and I get results on Friday, and everybody's like, oh my God, you don't get results the same day? You know, that would drive me crazy. Well, those of you there that are in a really large academic center, they see their they have their scans, they have their blood work, they see their doctor. It's all done in like a 2-hour time frame. So things like that would be awesome to have, like even like a City of Hope. I've gone to with a friend, a City of Hope, and just seeing how they have everything in one location. You have nurse navigators, which are amazing to help you coordinate all of that. We don't have any of that here, and that makes it really hard as a patient, especially in the beginning when my mom was by my side for every single appointment. You're going to multiple appointments a week sometimes to keep track of everything and coordinate between your oncologist and your radiation and everything that you're having done. You need help, and you kind of feel like you're on your own a little bit. So I think definitely the community coming together and being able to make this a good place to go to for healthcare.
Let me ask you a personal question. I've read that you have never smoked, that you worked in casinos, and that you fear that secondhand smoke is what may have driven your cancer. Have you seen the politics of that shift here in town? Is that a taboo subject? Have I just, stepped on a landmine? Is it impossible to fund the medical center and what Parvesh is trying to do if you were to try to begin changing some of the conditions that create these chronic problems? Have you looked at that at all? Because I get the sense you wanted to talk about that.
Yes and no. Initially, yes, I thought, how can working in that environment for 20 years not have affected my lungs, right? The more I learned and the more I learned about my disease, it is not driven by smoking. But I still feel that it affects everyone's health. I was a bartender. I was in that smoking environment for close to 20 years. I have a lot of friends in that community that have suffered chronic asthma and bronchitis as adults because of working in that situation. It was a huge passion of mine in the beginning, not just because of my disease, but for overall health care. I mean, for overall, just health benefit of everyone that works in casinos. I partnered with a local organization, American Lung Association, that's here in town. And I fought with them diligently going to Mesquite and Boulder City and trying to get some of the smaller cities on board to go smoke-free and to have clean indoor air, hoping that would kind of snowball. And there's over 500 casinos nationwide that are smoke-free, and they're not just the Indian casinos, and they are still making profit, and they're still building, their Harrah's and their Caesars, and they're still building new casinos, so they're not losing money. But the health factor, it's just so detrimental to everyone, but I honestly think Nevada might be the last state to fall when it comes to that.
Just in terms of the infrastructure you're trying to build here, is that an issue? I mean, smoking has been one of the shibboleths that was hard to talk about here. Is that something you're able to, in your role, speak to directly, or is it something you sidestep for the time being while you're building this infrastructure?
Well, unfortunately, I've never sidestepped anything. But no, look, let's look at this from the long-term standpoint. We've come a long way in this country when it comes to smoking. We're now talking about secondhand smoke. We're not talking about primary hand smoke, and that's reflected in the incidence of lung cancer. I mean, it's interesting, if you go back and look at the medical literature in the 1920s and 1930s, epidemiologists began to describe this new disease called lung cancer. They'd never seen that. They said, what is this? And that correlated with the advent of smoking in this country in the early 20th century. So, and if you look at the old, and you read the old epidemiology literature, the incidence of lung cancer was 5,000 cases a year. But it was like HIV in the early 1980s. What is this? And then it took us to the 60s to recognize that there was a definite causal link between smoking and lung cancer. And then as a society, we made efforts to reduce lung cancer through behavior modification, and we've done that. So lung cancer for a long time was the #1 the number one cancer in terms of incidence and mortality. Now, it's usually number 3 in terms of incidence. It's usually prostate and breast cancer, and lung cancer is number 3. So we've come a long way. Unfortunately, we haven't made the same progress in curing lung cancer as significantly. So I think let's give ourselves credit for making that effort. And now the fact that we're talking about secondhand smoke, which there is a correlation between secondhand lung cancer, secondhand smoking and lung cancer. So I think that's the next challenge that we have to face. And so, but we've made significant progress, and I think we still need to continue to overcome that challenge.
I want to go to the audience and get your thoughts and questions. Did you want to say something?
Just quickly, to date, there's about 220,000 people diagnosed a year with lung cancer, and 20% of those are never smokers. And I just feel like I have to address it because there is a huge stigma attached to lung cancer that it is only a smoker's disease. I was a never smoker. I know a 21-year-old diagnosed with stage 4 lung cancer. I met a 19-year-old that died last year with lung cancer. So it can happen to anyone that has lungs, but smoking is a huge
Yeah, thank you so much for raising that, because there's just a lot of this that gets oversimplified even in discussions. But Oscar, just really fast, one question I've been interested in, and maybe it's another landmine, is whether or not there's a generational problem in treatment. And I was talking in the last session a little bit about literacy among those that are practicing medicine out there in terms of the advances that are going on. You chair committees in this area, and I just, we've all had family members who've suffered or passed on from cancer. My mother from Oklahoma, when you read Sid Mukherjee's book on the Emperor of All Maladies, she clearly was getting treatments that the profession itself thought were basically kind of bloodletting, that they were so old and anachronistic, but yet they were still in practice in Oklahoma. So I'm just wondering to what degree you think that's a problem out there.
Oh, absolutely. So information is expanding at an exponential rate. Our knowledge is expanding at that rate. And so the only sort of way to do it is become an expert in a given area. That area can be defined by disease type or it can be defined by biology. But there is a definite need for specialization. And our current infrastructure really does not permit that to enough of a degree, in my opinion.
Thank you. Let me go to the audience. Question, comments? Yes, right here. Good morning.
Hi, my name is Demetria Murphy. So, as a lot of you guys know, the rates of cancer are incredibly high amongst amongst our African American community, particularly Black women. The leading cause of death with cancer is breast cancer with Black women, and the second leading cause of all Black people in terms of death is cancer. Specifically, my father passed away from colon cancer 7 years ago, and my mother is a breast cancer survivor, but currently we're actually going through the process of figuring out if her cancer has returned in some sort of way, but we've had a lot of trouble with treatment with centers here in Nevada. And so my question is, I have 3 questions. Number one, and the other piece that I want to mention too is that my mother is hearing impaired. And so as I think about the care that she's received, there definitely has been a lack of meeting both her culturally and linguistic needs. And so my first question is, to what extent are doctors and oncologists who are on the cutting edge of this treating their patients in a both culturally and linguistically responsive way to best meet their needs? Second question, what sort of accountability is there for our doctors around excellent care, so the ability to have literacy over the condition, have aligned actually treatment pathways, and to be able to educate the patient through that process so they can actually choose? So my second question. And then my third question is just general advice on being able to best advocate for my mother's treatment and care.
She'd be a great moderator.
Yes,
go ahead. Right.
I'll take the first question, and it's a great question. In fact, I was talking to Steve about this. We have this U54 grant from NIH. It's a $20 million grant that's going up for renewal in 2 weeks. And our focus for the renewal is, our primary focus is on health disparities, which is what you're referring to in terms of your first question. And there are many reasons for health disparities in the Mountain West and Nevada. Racial is obviously one. Ethnic groups, the rural population. If you look at the 7 Mountain West states, the density in Alaska is, the population density in the United States is 90 people per square mile. In Alaska, it's 1 person per square mile. In Wyoming, it's 5 people per square mile. It's the most rural, 70% of the population in Wyoming lives in the rural areas. In Montana, it's 65%. In Nevada, we have a paradox between what I call the population paradox between our urban and rural populations. Look at Nevada, 2 most heavily populated areas are Las Vegas and Reno, and there's nothing in between, but there are health disparities in both of those regions. So there is a way to address that, but I think it's what we've all talked about, and Oscar's talked about it. We need the capital investment in infrastructure to address health disparities.
Any quick reaction?
Yeah,
Oscar,
so I'll take number 2. We're, as physicians, being held increasingly accountable for our actions, thankfully. We are, at least in our practice comprehensive cancer center of Nevada, we're part of a network called US Oncology, and we are tracked in terms of what we call on-pathway care. So we are basically being forced to provide at least what would be considered standard care. We actually like to think we provide excellent care. I will say where I work, in my office, I have no qualms. I think you should, anybody who has a relative with cancer should come visit us, because we do provide that level of care. We basically treat everybody like they were a member of our family. That's my personal philosophy, and that's the philosophy of the colleagues that I work with. So I'm sorry that you've had that experience.
Let's take one quick question here. Yes.
Yes. Paul Harrison with the Las Vegas Review-Journal. Dr. Kumar, how will the UNLV School of Medicine help people like Lysa? She mentioned earlier the difficulty she had getting care, coordinating care. How will the UNLV School of Medicine, the Academic Medical Center, help that situation?
Thank you.
So, great question, Paul. Look, the bottom line is that the purpose, there are many objectives of having a medical school. One is to train the future physicians and address physician shortages in Nevada and the Mountain West states. But the other one is, quite frankly, in the case of cancer, is to reduce the cancer burden in Las Vegas so people don't have to go to City of Hope. They don't have to go to UCLA or USC Medical School to get their cancer care. There is a huge outflux of cancer patients, I can tell you, that leave Las Vegas and Nevada and go to California for their care. So we need a huge, what we would love to see in terms of cancer, our long-term vision, is to have an NCI-designated cancer center. Now, so if you look at the Mountain West states, the only outside of California, the only other states that have NCI-designated cancer centers that are close to us is the Salt Lake, the Utah Medical Center, as well as the one in Colorado. And that's it. There are none in Nevada, Idaho, Wyoming, Montana, Arizona. Now the investment for that, we don't have any facilities, and the easy part, believe it or not, is finding the capital for a building. But we're looking at to recruit basic scientists from, it's like, maybe I don't know if I want to use the Cleveland Browns as an example, but the only way they're going to get to the Super Bowl is they're going to have to bring in superstars from other teams, and they're going to have to pay them a lot to get there, because their own system hasn't worked. So that's what we're going to have to do. We're going to have to bring the best and the brightest, and they're going to be expensive. But a lab building to bring in basic scientists, you're looking at 250 million. But you multiply that by a factor of 2 to 3 to bring in the scientists who are going to make these discoveries happen. So you're up to 500, 750 million just in the first 4 or 5 years for that capital investment to have an NCI-designated cancer center. But that's our long-term vision. to have an NCI-designated cancer center in Las Vegas, and we're going to work with Oscar's groups and other groups to make sure what we're doing is shared with the community, so so everyone. It doesn't have to be just UNLV. We're here to make a difference for the entire community and the entire state.
We're going to have to end it there. I want to thank Lysa Buonanno for bringing her story to us and being willing to share it and reminding us that real people are what this is about. Parvesh, Kumar, Oscar, Goodman, thank both of you as well.
Thanks for having us.
Yeah.